Hi, I'm Haley, and this is going to be my proposal for a long-term residential rehab center for addiction here in Memphis. So this is a topic that many people might not know about, but there are only short-term rehab centers here in Memphis, and we are in need of a long-term residential program. Residential means that somebody lives in the place to complete the steps to graduate their program. I found on this website called Addiction Group, it says the first year post-rehab sees relapse rates of 40 to 60%. I believe that having a long-term facility gives people a place to go once they've completed their short-time program and have a couple more resources to get back on their feet. I read in the book that it's best to interview someone who has expertise or direct knowledge that supports your argument. So I came up with several questions to ask my mom, stepdad, and family friend who all have lots of knowledge in the subject. Introduce yourself and tell us about your current occupation.
My name is Leah Bell. I'm a registered nurse at Regional 1 in the neonatal intensive care unit.
What types of patients do you have that are a straight result of substance abuse?
We would say that the mother has MSA or maternal substance abuse, and when the baby comes to us and starts showing signs of withdrawal, that is NAS or neonatal abstinence syndrome.
What are the signs of withdrawal and how do you treat them in an infant?
Some of the different things that we see are tremors, difficulty feeding, nausea, extreme diarrhea, hypertonicity, so they're like really tight, shrill, high-pitched cry, unable to sleep, things like that. We treat using medications like morphine and phenobarbital. This helps them to withdraw from their medication that their mother has been giving them. So street drugs that their mother has been taking, the morphine can be weaned down so they no longer have to take it.
How do you think a long-term facility here in Memphis would directly impact your workplace?
I believe that a long-term facility in Memphis would help give mothers or pregnant women a safe place to be. A lot of times women will fall into substance abuse and maybe prostitution or trafficking, just any way that they can get those substances. And then they're stuck in a cycle. If they have somewhere to go to not only stop using substances, but also have a safe place to be, get treatment, have resources to get the health care that they need for them and their baby, coming up with a plan so they have somewhere to go after discharge, somewhere that's safe that they can take themselves and their baby. I think that would be important and would hopefully be able to have a decrease in the number of NAS babies that we have.
Now, to kind of transition, you also have personal experience with rehabilitation centers. Can you kind of explain how that experience was for you?
Yes, I have personal experience in treatment facilities. In 2014, I went to Lakeside Behavioral Health for 1 week. I was trying to stop drinking alcohol. I was there for 1 week, and when I left, I had nowhere to go in the city of Memphis that really fit what I needed, and ended up going to a longer term treatment facility in Nashville, which is where I got sober.
What would have been different if you were able to get the help you needed here in Memphis?
I think I would have been more focused on what I needed to be doing. I was concerned with what was happening at home, but I was unable to see my children for a little over a month. I believe that if I was in the city of Memphis, I could have had contact with them. I might have been able to see them more. And I feel like this would have given me more of a mindset to help focus on me, knowing that my children were okay.
Now, not only were you a patient at a short-term facility, you also had the opportunity to work at the same facility you stayed at. Could you explain how that was?
Yes, I was hired at Lakeside Behavioral Health in 2016 as a nurse. And I worked on several different units there, but one of the things that impacted me the most was the actual unit that I stayed on. I was then a nurse for those patients, giving them medications for withdrawal from substances. Um, Unfortunately, we would see the same patients over and over again. They would come in for a week and leave, and we would just call them frequent flyers. We always saw them. They had no means to go anywhere after the 7-day short-term facility stay. And so they would just go back to their old behavior, using substances. And then eventually we just wouldn't see them anymore, um, because they had overdosed and died.
First, introduce yourself and give a brief history on your facility stays.
All right, my name is Brad Bell, and I attended Judicare.
Where do you currently volunteer that helps in active addiction?
I volunteer with We Fight Monsters in Flanders Fields. Flanders Fields is a veteran nonprofit to combat veteran homelessness, PTSD, and substance abuse. We Fight Monsters is combating human trafficking and substance abuse and child exploitation.
How did you get started volunteering here?
I started volunteering there. A buddy of mine started those two nonprofits. Being in recovery, we're a pretty tight knit community, and one of his posts that was made spoke volumes to me. So I reached out via Facebook and said, "Hey, I think we're trying to do some of the same things here, so I want to help out."
Okay, and what type of people are you working with?
Working with veterans that are homeless, veterans that are struggling with PTSD, veterans that are struggling with substance abuse issues, as well as mental health issues. There's another organization called Irreverent Warriors that I do volunteer with. They are trying to improve mental health using humor and camaraderie to improve mental health and prevent veteran suicide. So partnerships between all of those different organizations and making things happen here in the community is something that I try to be the driving force for.
Do you often see people that clearly need more help than what's being provided to them?
I do. Sometimes people know they need help, but they don't want to put the action to it. But the Memphis area doesn't have a lot of the long-term resources that we could probably use here. We have a ton of short-term stay facilities that are typically 28-day programs.
How often do you encounter relapse?
Relapse, unfortunately, happens more often than we want to admit. I think a good statistic would say, about 30% of the people that are first time in recovery make it without a relapse. A lot of people go back and forth on the cusp, and they'll get 30 days, they'll get 60 days, 90 days, or they'll get a year, and then they'll think they'll got it, and then they'll go back out there.
If long-term facilities were opened, how do you think this would change their outcome?
I think if more long-term facilities were to be opened, it would greatly benefit the recovery community in the Memphis area. Um, they say it takes 21 days to break a cycle, and with a treatment center being typically 28 days, you are just now really getting your footing and making changes in the way that you live and operate in your life. Uh, I don't think a lot of the social problems are going to be solved in 28 days. You're getting a good foundation, but anything 96 months or up to a year would really give someone really wanting recovery a really good solid foundation to build upon for a future life.
What is something misunderstood about addiction or rehab?
Addiction, I think, has a big stigma that, it's bad people that are doing drugs. Um, being in recovery for almost 7 years has proven to me that addiction can literally happen to anyone. Addiction doesn't care about how much money a family has had or where that family has come from, whether it starts with an injury that progresses into a prescription pain pill that then progresses to a street drug, or if it's just a childhood trauma and then you're just trying to cope with substances through those issues. Again, addiction doesn't discriminate on who it targets. Addiction could happen to anyone.
What can be done to help make a long-term rehabilitation center here in Memphis?
More grants and the insurance world, because they're trying to pay for it. So if we could get a few more nonprofits in the area that are raising capital funds to help pay for those longer term stays, and working with the insurance companies to reduce the cost of treatment, because treatment's expensive. I think the average bed cost in the insurance world about $1,000 a day is what insurance is being billed for. I don't think treatment should not technically cost that much. So if these providers and these facilities were to reduce their cost and work with the insurance companies to reduce the out-of-pocket expense on people that are trying to get some help, then it would help out a lot.
Introduce yourself and history on your facility stays.
My name's Cody Ables, and I've had multiple stays. Just a couple of them are CAPS and Safe Harbor.
What programs do you currently volunteer with?
We Fight Monsters in Flanders Fields.
Did the length of the programs you've completed feel long enough?
I honestly never really completed them, so I couldn't tell you on the length of the time, but from my experience with people and the things that I do with my volunteer work, I've noticed that the short-term programs just really isn't long enough to mentally prepare them for the journey that's in front of them. So that'd be my personal opinion on the lengths of some of these places, is that it's just not long enough.
What is something you wish the program offered but didn't?
The availability of long-term treatment for some of these clients, they get them and then they detox them and then they just kick them back out to the street. Really no planning behind that. So I would really like to see like some in-depth planning, some steps that they can have to take upon the discharge from their program. That would be great.
What does recovery mean to you now?
Well, recovery means everything to me now, because at one point in my life I had nothing. I didn't even have myself. So, you just look at it as like a second chance at life. And that's what recovery is pretty much summed up in. The short-term thing is recovery gave me my life back.
Why do you think more long-term facilities are not available?
I honestly really don't know why they aren't available. I would say maybe a profit thing, if you ask me, maybe. But
If long-term facilities were opened, how would this affect the outcome of the people you help?
I have a belief that if the long-term treatment was readily available, that we could constantly work with these people over an extended period of time and actually set goals and have steps ahead of them that they can take as soon as they discharge from that program, whether it be 6 months to a year, somewhere in there, so they can have a plan prepared and be ready to execute that plan upon discharge.
After watching these 3 interviews, I hope you found them interesting and learned a couple things you didn't know before. I think in order to make this a possibility here in Memphis, we need sponsors, donations, funds, we need a building and beds, we need certified people who can help and people who are willing to get the help.